Have you ever turned your head and heard a loud click in your neck? What if you could stop that sound instantly with one simple routine? Stick with me. This might change how your neck feels forever. Why your neck makes those clicking sounds. Most people hear clicking or popping in their neck and immediately worry that something is wrong, but the truth is often much less dramatic. Neck clicking happens when tight muscles and stiff joints stop moving smoothly, causing gas bubbles, tendons, or ligaments to shift rapidly during motion. For many people, long hours on phones, computers, and stressful postures create uneven tension across the neck and upper back. Because those muscles pull differently on the joints, the neck can feel rough or noisy during movement. The important thing to know is that these sounds alone rarely indicate danger. They simply tell you that your neck needs mobility, balance, and gentle activation to restore smooth and quiet movement again. The finger hook method to activate your neck muscles. To begin improving neck mobility, the finger hook method helps activate the deep stabilizing muscles behind the neck and across the upper back. Start by interlacing your fingers lightly and pulling outward just enough to feel gentle tension between your shoulder blades. While keeping that tension, guide your hands slowly through a large controlled circle in front of you. The goal is not speed, but smooth, steady activation. After about 5 rotations, reverse the direction and repeat. This movement helps warm up the entire shoulder girdle and reduces stiffness that contributes to clicking. You can also draw shapes like squares or figure eights to explore tight areas. As the muscles engage, you should feel more warmth and less resistance throughout your upper back. Head tilts and circles to restore smooth motion. Once the upper back is active, adding slow head tilts begins restoring flexibility to the neck itself. Keep your spine tall, then lower your ear toward one shoulder until you feel a comfortable stretch. Hold briefly and move to the other side. When your neck starts feeling loose, draw a slow circle with your head, going forward, to the side, backward, and around again. Move gently and avoid forcing any angle. If you notice an area that clicks, reduce the movement slightly and continue circling within a comfortable range. Over time, these circles warm the joints, rebalance the muscles, and help the neck glide more smoothly without the sudden noises. Consistency is key. Small daily repetitions lead to large improvements. Releasing the upper trapezius for immediate relief. The upper trapezius is one of the most common sources of neck clicking, especially for people who feel tightness along the shoulder and side of the neck. To release it, place the hand of the tight side behind your lower back. This position drops the shoulder and stretches the trapezius automatically. Then use your opposite hand to gently pull your head toward the opposite shoulder until you feel a deep but comfortable opening. Add a slight upward rotation, as if looking toward the ceiling. This enhances the stretch along the entire muscle. Holding this stretch for 15 seconds and repeating it a few times can release tension rapidly and reduce the friction that causes clicking during head tilts or side bends. The levator scapulae stretch, known as the armpit sniffer. Another major muscle behind neck clicking is the levator scapulae, which connects the shoulder blade to the neck. The most effective way to stretch it is using the armpit sniffer technique. Turn your head toward the opposite armpit as if trying to smell your shirt. Then gently pull the back of your head downward using the opposite hand. You will feel the stretch deep along the top corner of your shoulder blade, rising toward the back of your ear. This muscle often becomes tight from poor posture or from looking downward at screens. Stretching it helps the neck rotate more smoothly and reduces the catching sensation many people feel when turning their head. stretching the SCM to improve rotation. The sternocleidomastoid, or SCM, is the long rope-like muscle responsible for turning the head. When this muscle becomes tight, it can create clicking during rotation or even mild pulling sensations. To stretch it, rotate your head away from the tight side and gently tilt your head backward as though letting your ear fall behind your shoulder. The stretch should travel from the base of your skull to your collarbone. Hold this position for about 15 seconds. Release and repeat. Releasing the SCM often leads to an immediate improvement in rotating your neck without noise. Many people notice they can turn farther after just a few rounds. Chin tuck training to reduce clicking at the source. Now that the surrounding muscles are loosened, it's time to strengthen the deep neck flexors that stabilize your cervical spine. Begin by placing 2 fingers lightly on the front of your chin, then glide your neck backward without looking down. The motion is like sliding your head straight back. Once in position, place your other hand on the back of your head and press gently backward while guiding your chin slightly downward. Hold the tension for 5 seconds and relax. Repeat 5 times. This exercise strengthens the stabilizers that keep your neck joints aligned during movement. If turning your head normally produces a click, stop just before that point, hold the tension, and perform the chin tuck. Over time, your neck will gain more control, and the clicking threshold will disappear. Using a peanut tool to release deep tension. For stubborn clicking caused by stiff muscles along the spine, a peanut-shaped massage tool can provide significant relief. Lie on your back and place the peanut under the base of your skull. Gently press your head downward and perform small nodding motions by lowering your chin and then lifting it again. The peanut digs into tight knots and improves blood flow in the small, stabilizing muscles that are difficult to reach manually. Move the peanut down your neck gradually and repeat the nodding at each level. If one side feels tighter or clicks more, rotate slightly toward that side and continue nodding. This focused pressure often releases deep stiffness that contributes to clicking during everyday movement. The towel traction method for joint decompression. Another effective technique involves using a rolled towel for gentle traction. Place the towel behind your neck and pull the ends slightly forward while pressing your head back into the towel. This creates a mild decompression effect. After establishing pressure, slowly nod your head downward and then look upward toward the ceiling. Slide the towel down a little at a time to target different regions of the neck. If turning or tilting your head usually produces a click, perform the movement gently while maintaining traction. The towel stabilizes the joints and reduces friction, helping your neck regain smoother motion. A simple daily routine to keep your neck quiet and loose. Putting everything together creates a complete routine that keeps your neck moving smoothly and reduces the clicking dramatically over time. Start with the finger hook activation for 1 minute, followed by 1 or 2 targeted stretches, such as the upper trapezius or levator scapulae release. Add 30 to 60 seconds of chin tuck strengthening, and finish with either the peanut tool or towel traction for 1 to 2 minutes. This 7-minute routine balances activation, stretching, strengthening, and soft tissue work. Most people notice improvement within days, and many eliminate clicking entirely by practicing consistently. Closing thoughts to keep your neck healthy. Neck clicking can be annoying and sometimes alarming, but most of the time it is simply your body's way of asking for better movement and more balanced muscles. With gentle stretches, light strengthening, and deliberate mobility work, you can restore smooth and quiet motion more quickly than you might think. If one technique in this video helped you, keep it in your routine. If multiple methods worked, rotate between them so you cover every part of the neck. And as always, if you experience pain, numbness, or dizziness, consult a medical professional. Take care of your neck, Keep exploring gentle mobility, and thank you for spending this time improving your health.